Hair loss can be a frustrating and distressing experience for many people, leading them to consider hair transplant surgery as a solution. One of the most popular hair transplant methods is direct hair implantation, DHI, which involves implanting individual hair follicles directly into the scalp. Like any medical procedure, DHI has its pros and cons. In this video, we will discuss the benefits and drawbacks of DHI hair transplant. Pros. Natural results. One of the biggest advantages of DHI hair transplant is that it produces natural-looking results. DHI allows for precise placement of hair follicles, mimicking the natural growth pattern of hair. The hair transplant surgeon can control the angle, direction, and density of each hair follicle, creating a seamless and natural look. Minimal scarring. Unlike other hair transplant methods that involve creating incisions or slits in the scalp, DHI hair transplant uses a special tool called a DHI implanter pin to implant hair follicles. This tool creates tiny puncture holes that heal quickly and leave minimal scarring. Fast recovery time. The DHI technique is minimally invasive and does not require any major incisions, resulting in a faster recovery time. Most patients can resume their normal activities within a few days after the procedure. No need for shaving. Unlike other hair transplant methods that require shaving the entire head, DHI hair transplant allows for individual hair follicles to be implanted without the need for shaving the entire head. This makes the procedure more discreet and allows patients to return to work or social activities more quickly. Cons. Higher cost. DHI hair transplant is generally more expensive than other hair transplant methods, as it requires specialized tools and highly trained surgeons. Longer procedure time. DHI hair transplant can take longer to perform than other hair transplant methods due to the precision required to implant individual hair follicles. The procedure can take several hours or even a full day, depending on the extent of the hair loss. Limited donor area. DHI hair transplant requires a sufficient donor area on the scalp to extract hair follicles for implantation. If the donor area is limited, it may not be possible to achieve the desired level of hair density. Risk of complications. Like any surgical procedure, DHI hair transplant carries some risk of complications, such as infection, bleeding, or scarring. However, these risks are relatively rare, and most patients experience a smooth recovery. In conclusion, DHI hair transplant offers a natural-looking solution for hair loss with minimal scarring and a faster recovery time than other hair transplant methods. However, it is important to consider the potential drawbacks, such as the higher cost, longer procedure time, and limited donor area, before deciding if DHI hair transplant is right for you. As with any medical procedure, it is essential to consult with a qualified and experienced hair transplant surgeon to determine the best treatment option for your specific needs and goals.